This is my presentation on cultural competence. I would like you to imagine you're a healthcare worker working in a small urban city that has a lot of cultural diversity. It's an urgent care you're working in, not major emergencies, so you get a lot of time with your patients, and you want to start to build a connection. You do some research on it, and this is what you find. The use of complementary alternative medicine. You decide to introduce alternative medicine into your practice, so instead of strictly prescribing just drugs or sedatives or anything like that, you might instead try to prescribe a patient to go do yoga to help relieve stress, or to see a chiropractor for some simple neck pain rather than prescribing a high dose of ibuprofen. Vitamins and herbs as an alternative to maybe some sort of fad diets or something that isn't necessarily totally seen. Some of the other alternatives for CAM would be biology-based practices, energy-based practices, mind-body intervention, and manipulative body-based practice. You just really want to encourage all patients to feel comfortable, and if they aren't comfortable with prescription drugs, maybe you can meet them in the middle with something like this and finding alternatives for them. This is all about a journal on a study that was written and kind of studied just a couple years ago. 2020, it was in between 2018 and 2020, but the main journal was written in 2020. They used yoga and meditation to help defeat stress and help kind of combat stress disorders such as anxiety. So the way that this kind of works is they realize that yoga is a pretty free alternative for patients. It is way cheaper than Xanax or Valium, which is usually something that doctors will prescribe for people who have high anxiety. And they realized that yoga and meditation work just as well. And not only did it help with just anxiety, but people who also had neck pain, back pain, they got severe migraines specifically from stress or just from the thought of being stressed out. It actually really seemed to help. They were able to watch their brain waves and saw that it had almost the exact same reaction, which is really cool because you can go on YouTube and look up yoga treatments rather than prescribing costly, expensive therapies or prescription drugs. Another way to help with cultural competence is to reduce health disparities, and specifically in training new students to how to reduce them or to treat patients that may fall into a health disparity. Health disparities may include something of a minority in race, gender, sexual orientation, language barriers, poor financial situations, or something that makes them limited. They may be in a smaller place where there's not as much medical access. There's a lot of studies that are helping, which we'll talk about on the next slide, of introducing training for medical students early on in their education so that they grow with their education learning how to treat patients from a completely non-judgmental setting. It's to create a positive manner and to make people feel as comfortable as possible going to the doctor, because if they feel even the slightest bit of judge, they may not return, and that could be unfortunate in their case. This was a book tackling causes and consequences of health inequalities, and it's a practical guide. It was written in 2020. The authors wrote it. It is based in the UK, but this is the one I was talking about earlier, where it suggests that practitioners of any medical degree should be given proper training early on and not just, well, you should have done something else to not make them feel inadequate during your time with them, which is patient's time with a care provider. One part that I found very interesting was the quote that says, the day-to-day learning revolves around seeing patients, debriefing with encounters with a trainer or an experienced GP, reflecting on practice and undertaking workplace-based assessments, which all provide rich opportunities for learning about health inequalities. So this is basically talking about how you can help prevent healthcare inequalities by realizing that they're there and being aware that this might be something that someone else is facing that you might not see directly when you're speaking with them in the healthcare setting, but they might not have the medication or the money to pay for their medication. They might not want to take a medication. They might have known someone that passed away because of a medication problem. We don't know that, and we can't obviously sit down with every patient and ask them that, but understanding that there is training to reduce that is very helpful to have that early on in education for medical students. Another way to be culturally competent is to remember the ethics and values of others. Everybody has their own belief system. Everybody has their own thought process, has their own way of dealing with things. And understanding that patients are freaked out. Patients are probably not ready to deal with some of the stuff we're going to have to talk about or that a care provider would have to talk about. And remembering that their condition is their body and they're seeing it as it's a problem for them. We are treating the condition, but we forget sometimes, or care providers forget, that it is not always a problem, but they are a human. And remembering that they are entitled to their opinions and we cannot change their opinion about anything, just as you should not push a medical practice that maybe they're not comfortable with to them. Overall, the recap about this, being culturally competent is very important. It is important when you're treating a patient. It's important when you're talking just about simple procedures or medications. They may not feel comfortable, and we want everybody to feel comfortable going to the doctor. It's an important needs, necessity of life. Being culturally aware does not even have to resort to just being at the doctor's office. It could be with anybody. But being that there are other cultures, there are language barriers, there are dialects, there are belief systems. There's many different reasons why people leave situations. And it could be not just in the medical fair, but remembering to be aware of everybody around you and that everyone is different and has different views on life. These are my references. Thank you very much.